Hello and good afternoon. My name is Alfredo Hernandez, and I'm a volunteer with the LMNA Cardiac Diseases Network. And I also host some of our video series where I interview patients and family members and several other people who are affected by our disease. I am also a positive LMN patient and also a recent, well, 10 and a half years ago, 11 years ago, heart transplant. So I have a lot of experience with the disease myself, and I'm doing very well now. But today I have a great opportunity to be speaking with Deana Archibald. I met Deana at the Stanford conference that we recently had this recent May of this year, and I got to know her a little bit, and I heard some of her story, and I just thought it would be a wonderful opportunity for her to share her story for all of us. It would be very impactful and maybe educational. And I just thought it was an interesting story. So I asked her if she would be willing to share, and she said she would. So we are honored to be with her today. Um, so, Deana, would you tell us a little bit about your experience with the Stanford meeting? What did you think about that? Was that helpful for you, or anything like that that you can share with us?
Yes, I absolutely loved going to the Stanford meeting. They had, I have five kids that have tested positive for this gene, and they had a pediatric cardiologist there that gave some insights of things that I can do to help my children to better navigate when they're symptomatic. And I also enjoyed they shared the latest researches
Yeah.
that is going on. And going to that brought me a lot of hope for my children and what can happen for their future. And also, it was a good opportunity to see other people that have had it and like you are doing well and living life to their fullest, and that it's not a limitation, it's just something that you have to navigate.
Yes, yes. Well, that's great. I'm very grateful that you were able to make it to Stanford. It was a great opportunity for me and for yourself and for many people. And this is why we do these conferences. Now, of course, I mentioned you're not a patient yourself. You haven't been tested positive, but the reason why your story is so impactful and so interesting um, for us to share this because you were significantly affected through many family members. Your husband, we'll talk a little bit about that. Your sister-in-law, I guess your husband's father was the one that was also tested positive several years ago. And now, when I learned that all five of your kids tested positive, and your kids are from what age range? Just from the lowest to the top are your kids?
So my youngest is 9 and then up to 20.
Okay, from 9 years old to 20 years old, all five of them positive.
Yes.
So, I learned a little bit last time we spoke about your husband's story. And, I'll just say, he's not with us anymore. He's not with you anymore. And because of this disease. And, so we talked a little bit about it. And there are some interesting points that, I'd like to reference about that. But can you just give us a quick synopsis about how your husband dealt with the disease when he got diagnosed? Just anything that you would like to share for the community and for others that will be listening about him.
Yeah, so in his, like you said, his dad was diagnosed with this disease, and in 2019, my husband and some of his siblings decided to help with the research that they were doing on this, and they got tested. He opted not to find out because he figured that if he had it, he would find out when he became symptomatic. In about 2, 3 years after he was tested, he was in for a physical, and they realized that he was symptomatic. In 2013, he had his first ablation. In 2014, he went in and got an ICD with a defibrillator because we knew that that was important. We were actually getting care for him, a cardiologist who understood the gene, and that was very beneficial in saving his life early on. Um, then we ended up moving further away from that cardiologist and living in Florida, where we met with a cardiologist that did not understand the gene as well. And so subsequently, he had a lot of ablation surgeries to help with the AFib that he was having. And ultimately, he ended up passing away because we were not as proactive as we should have been. And I feel like it was because we weren't seeing a cardiologist that understood the gene as well. Not that I'm
So
blaming the doctor for, you know, that outcome. Is just that that wasn't his specialty. So we weren't being proactive, we were being reactive. And that's really not
absolutely.
good with this gene.
Yeah, it's not. When your husband became symptomatic and he had his first ablation, some of his first procedures, where were you living at the time?
We were living in Idaho, so he was seeing a cardiologist in Utah. And then when we moved to Kansas, we saw a cardiologist in Colorado, Dr. Mistroni, and she was amazing. And she was proactive and she made sure that he got his ICD in because of his history that his family members, cousins have had with it.
Sure. Okay. So then from there, you moved to Florida.
Yes.
And as you specified that when you were in Florida, you did get set up with a cardiologist, but this cardiologist wasn't very familiar with the disease. We're doing everything we can as a network, as a community, to bring the education to a lot of the physicians, basically around the world, the importance of people having knowledge. So when you move to Florida, he became sicker and sicker, is what I understood from our previous conversation, that he started actually going into heart failure. His heart function began to decline, regardless of the fact that he had already had some interventions and an ICD. Now, did he have a CRTD where basically it's a three wires, one to each side of the ventricles and one on top, or with a defibrillator? Is that about right? Is that what he had? So he did get the right
So, well, he
device.
actually ended up getting two ICDs, and the first
Okay.
one was just the two. And then that year that he passed away, he ended up getting the three lead, like you were talking about.
Okay.
So
So yes, and
a little too
so
late.
yes, yes. So he did get the BIV-ICD or the CRTD. There are several different types. But it's what is best for us currently. And but unfortunately, from what our last conversation, he continued to have significant decline in heart function, where he was developing cardiomyopathy, and possibly dilated cardiomyopathy, which is the worst outcome with this disease. And during that period of time, was it that there wasn't early on intervention in that heart failure, or you guys didn't get him on the transplant list, or just tell us a little bit about that experience?
So 9 months before he passed away, he was just having a lot more problems. His defibrillator was going off more frequently, so they did an ablation.
Okay.
And then they realized that they probably should change it to that three lead
Yeah,
ICD that
okay.
you talked about. And so he had that surgery and then had another ablation. And when his doctor that he was seeing, that was his specialty, was ablations, and he was really, really good at them. But when he realized that that was not fixing the problem, that's when he referred us to see the heart failure specialists. And we went and saw them on a Wednesday, and then he passed away on a Saturday. So it was just too late. Like we should have started that intervention probably. I mean, hindsight's always 2020, right?
Hmm.
Which is good because we're learning from this and like I'm going to be more proactive with my children. But we probably should have seen that heart failure specialist, 6 months before, 9 months before we'd gotten to this point.
Sure. I really appreciate your positive attitude about it, but in all reality, you did lose your husband. He passed away, and I last time we spoke, you told me he was 42 years old when he passed away, and that's extremely young. That's very young. You're just basically starting your life, and
Yeah.
I'm really sorry that that happened to you. So he went into heart failure. He had the right ICD, and um, for some reason, he was referred to the heart failure specialist much later than he should have, where he could have seen a heart failure specialist with gone and undergone interventions with them, and maybe even placed on the heart transplant list, and evaluated sooner, where he could have been waiting for a heart instead of from from your story or from our conversation, he passed away, not even being listed on the transplant list. He was not even, you were getting ready to get him evaluated, but then he passed away of heart failure.
Yes.
Okay. And I, I told you that it's a very sensitive situation because now we know that all that could have been avoided, and you would have had your husband,
Yeah. And like
kids, and
all those ablations weren't necessary. In fact, they were not helpful.
yeah,
So,
yeah, I understand. We do understand now that ablations sometimes will delay, but they're not curative. Obviously, they don't resolve. They're very short term solution for us. They buy us time, and that's about
they're more
it.
of a band-aid, not
Yeah,
a cure.
yeah, yes, exactly. I think that's a great perspective that you have about that. That's about right. And so, okay, well, I'm sorry you did lose your husband to the disease. Um, Now, you mentioned something about his sister. If you don't mind sharing a little bit about her, and she's not your sister-in-law. I apologize, his sister, and she's not with us anymore either. Is that correct? And would you like
Correct.
to share a little bit about that?
Sure. She passed away 4 months ago. Sorry.
It's don't apologize. Take your time. Take your time. We understand.
Um, and she also wasn't seeing a cardiologist that understood the disease. She was just on beta blockers, and she just wasn't getting the care that she needed. And she ended up passing out at home. Unfortunately, her older daughter was at home, was able to give her CPR, but it didn't help. Um, she should have had an ICD, and because that would have prevented what happened to her, is my personal opinion, not a doctor.
Well, we know enough about the research that is shared with us by the medical professionals that the risks that we have with the Lyme disease, that if we don't have an ICD, we could go into sudden cardiac death, or we can have a lethal arrhythmia, ventricular fibrillation. And so from your understanding, that's what happened to her. She was proactive, she was aware, she was positive, she knew the disease, but she didn't get the ICD in time. And so when she did go into that arrhythmia, from what they now know, regardless of the intervention, CPR at home, her heart just basically never came back. So, okay. And how old was she when she passed away?
48.
48. Okay. So you lost your husband, you lost your sister-in-law, and and you have 5 kids. And so, you know, were you still living in Florida when you lost your husband? Or
I
did you?
was.
Okay. And
Yep.
so where are you living now?
I live in Idaho. I moved. We lived in Florida because of my husband's job, and we loved it there. But when he passed away, we needed to be closer to family and hopefully better to. I hadn't tested my kids yet. I just barely tested my kids actually last October. So this is actually new information for me that all five of them have it, but it's good to be closer to
Sure.
family to help with love and support.
Absolutely. Now, so if with your permission, we'll move on to discussing a little bit about your kids. Um, Now, your oldest son, you have a daughter who's the oldest of the five, but then second to that is your second to the oldest is your son, right?
Yes,
And you shared with me he's what age now?
he's 18.
18. And that you said he was already having some symptoms and getting some treatment. Can you?
Yes, so he's having a little bit of AFib, and so they put him on a beta blocker, and that's working right now. The beta blocker is.
Sure.
Well, he's the only one out of the five that's symptomatic at this moment.
Okay. Well, that's good. That's
It's
good. They're
good.
all very young, but for even for being 18 and having symptoms, we that is very young as well. That's what this disease, this awful disease, does, unfortunately. Now, one of the things that I thought was pretty cool about you when I met you was that you were there in Stanford and we spoke, and you said that, you know what, you wanted to be prepared. You don't want to have the same avoidable things happen to your kids. You want to be
Yes.
on it. And that's great. That's the attitude that we need to have and family members need to have, and we need to advocate for ourselves or reach out to people that can help us and educate us. So you reached out to me, and you said you wanted to, get some more information. You wanted to get networked with the right people and things like that. And that's what the network's here for. And I was very happy to have the ability to be able to put people together because of my involvement with the network and get other researchers and other people in touch with you. And I thought was cool that you're just like so proactive and so on it, because you're going to take care of your kids and you're going to do everything that now that you have learned about from the disease and from the conferences and from education research and obviously studies that you have read because of your own family members, etc. So tell me just briefly some of the things um, that you've been working on, you have worked on, the things that you're putting together, things that you're doing to get yourself to be proactive for your kids.
Okay. One of the things that was helpful at Stanford is they had a list of all the doctors that are studying the genes. So, like now I have a list of doctors that I can have my kids go to that know how serious this gene is. And I also like that if I were to have a cardiologist that wasn't a specialist, that if they want to learn more, I can refer them to this organization and they can learn more if they want to become a specialist if this, in this area as well. But one of the great things is contacting you. You referred me to Dr. Taylor out of Colorado, who's a geneticist, and he was able to give me a report talking about the gene that I can give to the doctors. And then you provided um, that document talking about your journey and what happens with this gene that I can also give to my children's doctors. So like I can give it to my pediatrician so that he knows that if we're symptomatic, that it's serious and that we need to be referred to the specialists, like in Utah that can help us. And so far that's what we're navigating through is trying to get the medical care and the doctors in place that can help them in their journey.
Yes, and I remember when I first met you, you said, I'm putting together a folder. I need a folder. I need information. I want to go to the doctors with my kids and say, here's my folder. Here's the information. Here's the disease. Here's the gene variant that we have, and here's information from the network and from geneticists and other doctors. And I just thought, wow, if more people were as proactive, more and that more deaths could be avoided. um Sometimes there's nothing we can do, and sometimes people just pass away with this disease, as many of us have lost loved ones like yourself. But at the same time, if there are things we could do to avoid, to get people on the heart transplant list in a timely manner where they can get that transplant like I did. If it wasn't for that transplant, I wouldn't be able to be speaking with you today. And so getting the ICD to avoid the, like what happened to your sister-in-law as well. So I just thought that, that would be wonderful to share with everybody. And I just want to say from all of us, from the network and from myself, how nice it was to meet you. And also, how grateful it is that you were willing to share because you said, I will share if it can help one person, another person, if people can learn from my experience, from having the losses that you've incurred. And honestly, some of the biggest challenges is having all five kids test positive. And so, we're here for you. And if we can't provide you what you need, we'll find somebody that can provide you what you need. We're well networked. We'll put you in touch with, like I did, with whoever we need to put you in touch with. And I think you know that I'm always available to you,
Beautiful.
to get you the information, to utilize the resources of the network and I'm there for anybody that needs it as well. As a volunteer of the network, just to help save lives and help get improved outcomes and help people live the best possible life they can with this disease. It's not just the cardiac aspect of the disease, the muscular aspect of this disease. We're constantly learning new and new things all the time about some of the different things that we're being affected with our skeletal muscles as well as our cardiac muscle and so many other things. And so we share this knowledge. And I'd love to share the knowledge with anybody like yourself that's wanting to get informed and get prepared. So I just respect you very much for doing that. And I think that's wonderful. And I'm sorry for your experience, but I love your attitude, a positive attitude, and being able to speak about this and share it with us. Anything else that you would like to share with me or with the network or with anybody that might be listening, any family members or anybody that
The best thing to do is to be proactive, and I really appreciate this, institution that has given us a lot of information that helps us and can help us navigate this journey. And one of the things I took away from that seminar is that you don't have to stop living just because you have this disease. Like I told my children about you, Alfredo, and I'm like, he's still active and he's still doing things. I mean, he's trying to take care of his body, but please don't let this disease stop you in living because it shouldn't.
no,
It
you're
shouldn't at
right.
all.
And I started giggling just now because when you were saying this, I remember you communicated with me recently that one of your sons wants to play football. And you're like, I hope he doesn't like it, but unfortunately, I think he might.
It's
Is
true.
this now which one is this? What's
This is
his
my
age?
12-year-old.
Oh, wonderful. Okay, so he wants to play football. Okay. I remember during the conference, some of the medical experts saying, you know what? If the kids want to play football, if you want to play sports and do whatever, move, be active, just
Yes.
be prepared, just be knowledgeable and have the right intervention, medications, doctors, etc., available to you. But you're right. We just, we have to continue to live, do what we need to do, and I'm saying cool. He's going to play football, but at the same rate, I'm sorry he's going to play football because you as a mom, you worry about your sons getting hurt or
I
the
do.
elements. It's a cool sport. I played football in high school myself, and I had a lot of fun. But yeah, I can get a little bit aggressive sometimes. I think at that age, that's what they want. That's what they like. So and it's awesome that you're going to support him through it and just be watchful with him as well.
Yeah.
So anyway, that's why I was giggling because of that. So well, that's wonderful. Well, Deanna, thank you so much. I appreciate you sharing your story and sharing your time with me today and with the network and for anybody else that's going to be hearing it.